Hi, I'm Dr. Mark Gould, and welcome to my website for peripheral neuropathy relief. In this site, I've created a number of areas for you to find out more about me and what makes my treatment approach towards peripheral neuropathy so unique and different than anything you've experienced. On the left is an area for you to receive 2 free visits. I do this because I want to give you the opportunity to see if you qualify for care at our clinic, and it also allows you the opportunity to check us out without any financial commitment. If after reviewing the information on this site on our treatment approach towards neuropathy and you like what you see, all you have to do is either call the clinic, email us, or just fill out the information here on the right, and we'll get an information packet out to you, which includes a free DVD that goes into a full-depth explanation about our peripheral neuropathy relief program. If you're watching this video right now, either you or a loved one is suffering with chronic sensations of numbness, tingling, aching, weakness, loss of muscular control, even burning sensations into your feet and legs or hands due to a progressive disease that's affecting the nerves outside of the spinal cord. Peripheral neuropathy is a disease of the nerves that carries information from the brain outside the spinal cord. What you need to understand is the name for the condition doesn't tell us what's wrong with the nerves. It just identifies the problem. And just because you feel a problem in your hands or feet, that doesn't mean that's where the problem is. And it's a huge, gigantic misunderstanding, and this is where the diagnosis and treatment of peripheral neuropathy goes wrong, right from the very beginning. What I found in my years that I've been treating these types of problems is that most people don't have any idea what their options are. They think that they either have to continue to take medication that have side effects or just don't work, or there isn't anything else they can do, and they just have to live with the problem. And in both cases, it doesn't have to be this way. And here's the great thing. It's never too late to start. It doesn't matter how long you've had your neuropathy or what doctors you've seen, what medications you've taken. And the reason it doesn't matter is I'm going to take a look at you like no one else ever has. I am part of a select group of doctors across the country that are sharing diagnostic and healing methods that are helping thousands of neuropathy pain sufferers like you. One of my mentors, Dr. Michael Johnson, is author of this book, What to Do When the Medications Don't Work. This book and his ongoing work with doctors across the nation has literally changed the lives of thousands of pain sufferers and neuropathy sufferers throughout the nation, and has changed the way that I practice on a daily basis. I've traveled the nation to study and work with some of the top physicians in this area to make this form of treatment available at my clinic and to continue to educate myself on what's going to help you. So why am I different than all the other doctors you've seen, and what therapies do I offer that are different than anything else you've tried for your condition? Well, in a brief statement, we treat you metabolically and neurologically. Your nervous system needs 2 things to function properly and for the nerves to heal, and that's fuel and activation. Fuel in the form of properly regulated glucose levels and in the form of oxygen, as well as proper input to the nerves and brain. First of all, to understand where your problem is coming from, I want you to understand I will leave no stone unturned to determine the exact cause of your neuropathy. Here are some of the things we're going to look at when you come into the office. I'm going to discover all the parts of your nervous system that are not functioning properly through a very rigorous and comprehensive exam process. And then we're going to run tests, such as a food sensitivity testing, to determine if you have a sensitivity to gluten, milk, soy, eggs, or yeast. If you are sensitive to any of these food groups, it could be the cause behind your neuropathy and continuing to make your condition worse, as this will increase inflammation to your brain and nerves due to your immune system's reaction to these foods. We'll also run complete blood panels by using specific blood tests, such as a thyroid panel, along with specific antibodies tests, a complete metabolic panel, a lipid panel, and a CBC. With these tests, we can assess the function of your thyroid, adrenal glands, liver, red and white blood cells, and GI systems. All chronic conditions can affect all these areas, and by addressing these problems all at once at a functional level, we can help your nerves to heal faster. We also look at the function of your adrenal glands with a test called the Adrenal Stress Index. The adrenal glands are your stress organs, meaning they react to stress and are vital in maintaining proper fuel or glucose levels for the nerves. Remember fuel and activation? Well, the latest research also shows that your neuropathy could be caused by an autoimmune condition. So this is why we're going to run very specific immune panels, which are often the key to getting you well. So once I have your results, how do I successfully treat you? Well, I use these specific metabolic and nutritional protocols to restore the health of the affected parts of your damaged nerves and the disconnection that's been going on between the brain and the peripheral nervous system. We use specific brain-based therapies to restore proper brain and neurologic function, such as vibration therapy. We are also the first clinic in Illinois to use the LightCure deep tissue laser therapy system in our office, which is phenomenal for stimulating and healing the nerves in patients that have chronic nerve damage and in relieving pain. We may also use non-surgical spinal decompression, which creates a negative disc pressure and takes pressure off a compressed nerve in your neck or your lower back, and a slow stretch increases stimulation to the brain. Another great treatment we use is a special form of microcurrent. This is a clinically proven medical device that sends a comfortable electronic signal to the areas affected with peripheral neuropathy, which restores, stabilizes, and rebuilds the nerves of your extremities. And lastly, along with using natural specific nutritional protocols based on your test results, we'll use glutathione therapy. Glutathione is very effective with patients who have suffered with neuropathy, and you can read more about these in the article section of the website. Now, I know you've been through a lot, and at some point may have just wanted to give up, but I want you to ask yourself the following questions. How has your neuropathy affected your relationships, finances, family, or other activities? What does it cost you in time, money, happiness, sleep? Where do you see yourself in 1 to 5 years if this problem isn't taken care of soon? And what is it worth to you if we can improve or eliminate your condition? So how do we begin? Where do we start? Well, you can call the office for your free consultation. You can fill out your information to request a DVD information packet, and we'll send it out to you along with a comprehensive questionnaire that you're going to fill out before you come see us. Typically, there's about a 2-week waiting period for new patients coming to be treated, so please fill it out as soon as possible and get it back to us. Every day in our clinic, we demonstrate that functional neurology, functional endocrinology, and functional medicine work wonders in improving the performance of the human body. We believe that every person has the unlimited potential to improve the quality of their lives, and yet more than anything else, we believe in restoring hope, one person at a time. So if you want us to look at you, or you know someone who needs our help and needs answers, have them call us. Let's get some information in their hands, and let's help change their lives for the better.